everyone. Welcome to our short education series called Gastro Gyan, Gyan meaning knowledge. We'll be asking a series of questions to esteemed clinicians with a group of patient advocates on board to help steer these questions. Please stay tuned for this series. My name's Sharon. I'm a Crohn's patient advocate living with Crohn's disease since 2002, and I'm joined here today with Dr. Keefer. Would you like to introduce yourself?
Sure. Thanks for having me. I am a gastropsychologist, and that means I'm a health psychologist specializing in the psychological and emotional management of people living with Crohn's and colitis. I am a professor of medicine at Mount Sinai in New York City.
Thank you so much. So for today's topic, we'll be discussing what to know as someone who has recently been diagnosed with IBD. For our first question, Dr. Keefer, how do I navigate conversations with family or relatives who think IBD is just a phase or they don't understand the long-term impact of this disease?
That's such a great question. So, I think I have a few thoughts on that. One being that, I think when you are diagnosed with an IBD, there's a lot of pressure to disclose that information to everybody. And everybody kind of has a very different reaction depending on their own history with illness, their own fears about being sick and being cared for. And so many times we, as patients and patient advocates, will sort of absorb other people's anxieties about our diagnoses, right? So I think one idea is to really kind of think about how other people might be imposing their own beliefs that have nothing to do with you onto your health information. And when you can do that, when you can kind of separate a little bit around other people being uncomfortable with hearing this information because of their own issues, it becomes a little easier to identify who is going to be an actual member of your support system. And this can be really disappointing for people to find out that certain people that they may have thought were going to be super helpful or excited to support them aren't. And other times people are pretty surprised by the type of support that they can get from other people. I think the other part of this navigating conversations is to really kind of have a curious, open mind about what other people might have to offer. Scientifically, I would say that, there's sort of three different types of support that we all need for any kind of crisis. And so when you're navigating conversations, I think sometimes it's a matter of listening for what type of support somebody might be able to have to get them away from this idea of it being a phase or, down the road, right? So to begin with, informational support, right? So who in your network, who in your family maybe already has the condition, who maybe already has a sense of things that might work for you, who maybe is a doctor themselves and knows how to navigate the system through that way, who can kind of do that. Second, emotional support. Who's going to just be there to listen to you cry, tell you that things are going to be okay. If they're nearby or far away, they're there for you to pick up the phone and just say, I'm having a really hard day. And then who's that instrumental, practical person that may take you to your colonoscopy, take you to your surgery, go to the doctor and take notes with you? No one person is going to make all of that support for you. And so I think when you're navigating these conversations, it can be really helpful to think about what do you need from the person. And maybe, you won't need them until 5 years down the road when you need a ride to your colonoscopy, and that's okay. That's how that person can kind of help you. I think, I know it's sort of a long-winded answer to that question around navigating phases, but this is a long-term disease and people are going to show up for you in different ways over time, and no one person is going to meet all of those needs. And so kind of really trying to compartmentalize as to when I talk to somebody about it, not only are they bringing their own issues to the table, they also may not necessarily be prepared to help me right now, but that doesn't mean that they won't eventually be of value to me in my support network.
Thank you so much, Dr. Keefer. That's really valuable advice. And I like what you said about people passing their beliefs onto you. I feel like I've experienced quite a lot of that where they kind of assume that this condition is what they want it to be and what they believe it to be. So thank you so much for that. Well, the second question, so as a newly diagnosed patient, say, like, I'm worried about feeling isolated from my community because I won't always be able to take part in certain festivals and food-filled events, especially during the holiday period. And so what steps should I take to better cope with this? And do you have any suggestions on how to navigate any guilt or shame I'm feeling about this?
Yeah, this is a really tough one, right? So much of our cultural and celebratory events revolve around eating and in physical closeness and engagement with people. And so I think the first part of being diagnosed is often grieving the loss of that, or the loss of the potential for that in the future, right? And then with that also comes the being self-conscious, right? The assumption that people are kind of noticing if you don't eat something, or noticing if you don't engage in an activity, or maybe you leave early or come late. And so I think some of it is also just our own, kind of coming to the table, sort of being very aware of how others are noticing us. So I think for that more broadly, and I'll talk about food in particular in a second, but I think navigating that more broadly is to really make sure that those feelings of shame and guilt, don't kind of come in and internally eat you up. And we do that really through self-compassion. And self-compassion is actually a very legitimate scientific intervention to counterbalance those feelings of shame and guilt, right? To sort of say, it's okay to be like this. I didn't bring this on myself. It's not my fault. I may be different, but it's okay. I can still be part of a community and be part of my rituals and culture. Secondly, I do think it helps to master, what I say, sort of master your elevator pitch around what is your condition and why are you behaving this way, right?
Mm-hmm.
So just like you might say to your friends at the bar, oh, I don't eat that, or I don't engage in that, or that's not something that agrees with me. And really kind of practice that in front of the mirror, so that when you're feeling self-conscious or ashamed or uncomfortable at an event, you have a quick answer and you're like, I agreed to this. I already told myself that this is how I was going to handle it, to reduce some of that anxiety. And then the third thing is really to find aspects of the rituals or festivals or prayer or, anything that you might have not previously spent as much time on, that you want to learn more about and engage with, right? Not everything has to be related to food. I think that often can play a part, but maybe there's something else you're curious about that you can use to sort of still drive meaning and pleasure and community from your event.
Thank you so much, Dr. Keefer. That's, again, really valuable advice. And what you said about the elevator pitch, I think that's something that, can take some time to work on. But I really like your advice of practicing in front of a mirror so that, you've got it down. And I really love what you said about, focusing on parts that maybe aren't focused on food when it comes to these events and festivals. I have often, I'll show up sometimes after all the food and everything has happened, so that I, in myself, don't feel like I have to talk around all these issues. And I think we should have the autonomy to share as much as we feel comfortable with. I do feel like sometimes oversharing as a patient can become a real issue. So really, I think setting those boundaries is important as well.
Absolutely.
Thank you so much, Dr. Keefer, for joining us today. And thank you to the audience for tuning in. Please do stay tuned for more of these short education videos that will be dropping over the next few weeks. Thank you so much.